Hi guys, this is Dr. Patel, everything fourth trimester and putting a big lens on our maternal mortality crisis in the United States. Today we're going to discuss Tennessee, so check out this article, check out all the data, and then let's discuss. The year after denied abortion. This article was published in ProPublica on February 14, 2024, and it highlights this mom, Maren Michelle Hollis. She's 31. She's been 3 years sober. She's had 3 other kids, and she found out she was pregnant. Essentially, the doctors had stated that this pregnancy had implanted where her scar tissue was from her previous pregnancy, and it would be detrimental to her health. However, due to these Tennessee laws of the strictest abortion laws in the country, she was unable to have an abortion, unable to make the right medical choices for herself, and her story unfolds. So her narrative goes on that she actually ended up having a premature baby at 3 months, and because Tennessee does not have any sort of maternal or parental leave, she had to go back to work at 3 weeks. She had to navigate her job. So at times she was actually sleeping in the car just to be with her baby in the ICU. During this time, she's trying to figure out how to get all these resources that Tennessee has said that they would provide. And as a physician working in this field and exclusively in this field, we see so many barriers and so many red tape that we can't get the resources that we taxpayers pay for to help with social safety nets. So please, let's kind of be very blunt about this to the people who actually need it. She had to navigate all of that, and at the end of the day, it was basically, in her words, that the state forced me to have this baby. I could have died, and then there was no support for me and my husband to actually create this family. Now let's look at the maternal mortality rates of Tennessee. So the first thing you notice is it's high, right? So the top, let me just kind of orient you guys to this graph really quickly. So it's number of pregnancy associated deaths is on this axis. And then the difference between the lines up on top and then the bars, the lines is actually telling you a rate, a maternal mortality rate. And then the numbers on the underneath are the absolute deaths that have occurred. So as you can see, the rate is really high. So that means that there is a high risk of women who deliver or have babies in Tennessee of actually dying. So the risk is very high of them dying, and this is the absolute number of women who actually succumbed to these deaths. Now, I always get floored from this data from any state. This data, the next set is, were these deaths preventable? So of those 78 numbers that we saw, were they preventable? 66, so absolute number, 85% the percent, were preventable. So we could have saved 66 lives. In this great state of the United States, we could have saved 66 lives. I get very cynical at this point because the fact is that we live in a country, apparently the richest country in the world, and our healthcare system cannot even save our own mothers' lives. Okay, I digress. Back to data. Now, what is one of the leading causes of these deaths? And unfortunately, Tennessee is also having an effect on the substance abuse crisis that we're seeing all across the country. And most of these deaths, so 33%, are related to substance abuse disorders, followed closely by mental health conditions, which could go line in line. And then we have the obesity or actual physical health issues that are causing these deaths. Now, this next chart is really want to dispel this myth that it is to a certain education level or to a certain socioeconomic level, because this is a pervasive issue. And with a pervasive issue, what Tennessee has done, and this is actually the first state I've actually seen this data on. I mean, I might just not be looking the right place, so I will totally take that upon myself. But what Tennessee did was like, okay, let's look at the education level of these women. And here you go. So they also divided in pregnancy related and pregnancy associated but not related. That's other jargon. We'll make another video on the differences in that. However, when we have education levels, what we're seeing is that it's affecting again, less than high school diploma, GED, or more than a high school diploma in GED. And look at that, guys. Pregnancy related, 48%. So it really is not affecting, meaning like if we actually bring our biases in and we're like, oh, it's a socioeconomic issue, that means the lower people, the poor people, the people who aren't educated are being affected by that. But then when you actually look at the data and have data-driven policies, you notice, boom, we actually have higher educated women and mothers being affected by this. So again and again, what this is saying is this is a pervasive, universal issue that we need to tackle head on and reduce the stigma and create policies that are universal, rather than isolating and rather than actually causing more stigma. So for example, in my line of work, I'm a NICU doc also. I mean, anytime I tell a family that, hey, we're going to send some help to you guys, and the first thing that they know, especially if they're from lower socioeconomic stance, is like, oh, you're sending CPS on me, right? And so that's what we've created, that narrative. However, when we actually look at the data and you're like, oh my goodness, these are really also educated women who are being affected by this. So maybe it's not the education. Maybe it is the system that we are practicing in. And the policies that need to be changed need to create a universal policies to reduce the stigma of help. Again, feel for this mom and all these decisions that she had to make. That must have been so traumatizing to her, especially when she had to struggle in getting, the state had a couple of her kids in care, and now she's struggling to balance a baby in the NICU, another basically a 1-year-old to almost 1 to 2-year-old, and navigating the social networks that supposedly is supposed to be provided. This is gritty, this is real, this is what people face on a daily basis. So can we stop? I don't know. Can we just really take it in, sink it in? Please, I am open for discussion. I love bringing light to this, but I'm also a huge learner. So if I'm missing anything, please, I would love to know about this. So again, the whole thing comes down to abortion laws. Was it really the thing with abortion laws? And we've done this over and over again, as we've shown that if we look at an access to healthcare issue, then we give people choices and we actually save lives. There's a video that I've done previously where that we have overlaid abortion laws over maternal mortality rates, and it is very clear. If you look at the data, so again, this is data-driven platform, so please do not bring your opinions to here. Please bring me data, since I like to produce data for you guys too, is that when you overlay those things together, the higher the restrictive abortion laws are, the more maternal deaths we see. Thank you guys. And again, this is Dr. Patel, Everything Fourth Trimester.